you're over the age of 35, you may be entering or in perimenopause and not even know it. So today we're going to talk about some of the things that you can look out for, things you may be experiencing, tell you what it means, and tell you what you can do about it. So perimenopause actually starts for many women at the age of 35. Why is this important? At the age of 35, our hormones start to change. We start to have a natural decline in testosterone, a natural decline in progesterone, and in estrogen. There's a reason why your OBGYN may say to you, if you have not yet had kids, if you want to consider harvesting your eggs. But what about the rest of your life? So as our hormones start to decline, there are going to be things that happen, such as mood instability, sleep issues. All of a sudden, it may be harder to lose weight. All of a sudden, you may feel more of a hangover if you have a drink. All of these things could also be attributed to other life stressors. As we get into our 30s, as we get into our 40s, we have more responsibility in general. It's easy to attribute the symptoms of perimenopause to things that are just going on in our life, when in actuality, knowing what's actually happening with our hormones can make us better function and thrive versus kind of flailing around and going through some of these changes. In addition to the system-wide things I just mentioned, it also has an impact on our pelvic floor and on our pelvic health. Many people don't know, and why would you, that the pelvic floor actually has estrogen receptors in it. So if our hormones are declining, in addition to the normal age-related changes that we're feeling everywhere else in our body, including things like osteoporosis, our pelvic floor muscles start to become compromised. They will weaken even if we're doing the best we can to keep our bodies healthy. The pelvic floor needs particular attention during this period of time because if you optimize your pelvic health, you are going to do better in the long run for things like incontinence, prolapse, back pain, hip pain. The pelvic floor muscles are part of our core. And under normal optimal functions, when we use our core muscles, the pelvic floor muscles work with it. If anyone has delivered a baby, or if you've had any type of pain condition, whether it's pelvic pain or back pain, your pelvic floor muscles may not be working properly with the rest of your core. Combine that with the age-related hormone decline, and then you're leading into pelvic floor dysfunction, which really affects at least 50% of women by the time they're 50. A lot of women over 35 may start feeling a little bit of anxiety, some depression, maybe they haven't had that before. And if you go speak to a PCP, your primary care physician, a psychologist, a psychiatrist about this, they may not necessarily think to ask how old you are and if you're in perimenopause. We can't stress enough how much our sex hormones have an influence on every single thing we say and do. We wonder why a pelvic floor physical therapist is sitting here talking about this today, because it also affects the pelvis. But in addition to it showing up in pelvic floor dysfunction, we also have to investigate what's happening in our patients' lives. And it may not be something that is anxiety and depression that they haven't felt before, but their brain and the chemical synthesis of the hormones are not acting the same way that they're used to. If you had PMS for 2 days, it might be for 4. It may be more intense than it was before. As testosterone decreases, and it's the first thing that starts to decrease, we may feel fatigued, less energy. You can think it's because of your kids. You can think it's because I have so many responsibilities. That, in fact, may not be the case. And we don't want women going down the wrong path when, in fact, it could be a hormonal change that we just better need to understand. So as these changes happen and our hormones start to decline, the way that you can overcome that is by working with your pelvic floor and core muscles together to strengthen them, which can completely override this natural decline in hormones. Most people exercise. You may go to a personal trainer, you may do things on your own at home, and when you're strengthening your abdominal muscles, under normal circumstances, the pelvic floor muscles also contract to help us maintain continence as we do these exercises that increase intra-abdominal pressure. Sometimes things go awry And our pelvic floors may be doing the opposite of what they think they're doing when we do these types of activities. And that's where an evaluation with a pelvic floor physical therapist can come in handy to make sure that you are not compromising your pelvic floor by doing well-intended exercises, both for fitness and for our core strength. If you're over the age of 35 and in perimenopause, even if you didn't know it until just now, you're experiencing the symptoms that I've talked about, I'm including links in the description below to help get you to medical doctors, naturopaths, and pelvic floor physical therapists who can help you deal with these changes.